Over the last few years, there have been really thousands of reports and studies looking at probiotics, these bacteria that might alter pediatric illnesses throughout neonates to infants to older children. And they're really quite controversial because despite the fact that there have been so many studies, it's not clear where they're clearly efficacious and where we need to do more work. So in the session today, we're going to look at 4 of the particular conditions that they're most studied in and examine whether we should be using them as standard of care in our practices. Lots and lots of pediatricians are considering using these fairly inexpensive, simple bacteria to treat their patients, and yet the data is difficult to interpret and controversial. So I think we're expecting to see pediatricians, neonatologists, gastroenterologists, and dietitians to try to understand in their certain practices whether they should be using these, which of these many different products they should be using, and in what capacity they should treat these patients with these interesting bacteria. Our intent is for them to have a better framework for considering using these in the conditions of infantile colic and inflammatory bowel disease, whether you should give them to the high-risk premature infants to treat or prevent necrotizing enterocolitis. And the last talk is probably the most provocative, where we suggest that probiotics might influence whether people end up developing obesity as adults. And so if we could interfere with that process, we could probably save billions of lives and billions of dollars over the next several decades.